It's 3:46 here on 5AA. Occasionally I have trouble sleeping. I might get up during the night and never thought of a solution, but my next guest might be able to help me. Dr. Vivek Eranki, how are you today?
Very good, thank you, Richard. Thank you very much for having me.
No, thank you for coming on 5AA and talking to me. When I read the email that came to me, grinding teeth and sleep, is there an issue there?
Yeah. So stress is one of the most common causes why people are grinding their teeth. And grinding their teeth is one of the most common sleep problems out there. And it's called bruxism. And bruxism is essentially spasming of your masseter muscles that causes the clenching of your jaws and grinding of your teeth, which usually happens at night. And what basically happens is when people wake up, they find that they've got headaches, they've got jaw pains, and that could subsequently lead to dental problems such as broken teeth if it's not addressed early.
And what's the answer? I mean, people go to the dentist and they say the dentist is grinding your teeth, and then they go along and sometimes you've got to wear a mouth guard, don't you?
Correct, yeah. I mean, people either go to the dentist before the issues happen or after the issue happens, and you really want to avoid the after, simply because if you go to the dentist after you get the dental problems, I mean, you're looking at broken teeth and dental implants or dental crowns, which could be painful and expensive. So what you really want to do is to avoid it before. And the answers there would be dental splints are very common, or otherwise stress management techniques, but more and more patients are typically turning to Botox for their masseter muscles. And the reason for that is that the treatment itself takes typically 15 minutes. It's about 2 to 3 injections per side.
Right.
Very mild discomfort. It kicks in about 2 weeks time and lasts about 3 months. And what that basically does is that it reduces the action of the masseter muscles, so it reduces the grinding. So the mouth guards pretty much protect the teeth, but they don't actually stop you from grinding. But the Botox injections into the masseter muscles weaken the muscles so they can actually stop you from grinding, and hence it might prevent further issues down the track.
Because a lot of people would say, will I look better if I have Botox injected into my mouth? Yeah, there is that part as well, isn't there?
Correct. Yeah, there's a lot of people who get Botox done for aesthetic purposes. So these are people who get Botox into their masseter muscles to slim the masseter muscle. So typically this is very common in females that basically want a lower profile of the lower face, and because it slims your face, it looks more feminine. But there are more and more people who are turning to this treatment for non-cosmetic reasons. I mean, pre-pandemic, we were treating about 25 patients a week. Post-pandemic or during the pandemic, we were treating about 50 patients a week wanting masseter injections.
Wow.
And now the interesting thing is, before the pandemic, only about 20% of patients were having the masseter injections for bruxism or grinding their teeth. Now, this is gone now up to 80%. So what this basically means is that there are more and more patients who are grinding their teeth and clenching their jaw now compared to before COVID. And when we spoke to patients as to why, there's a lot of there's been a lot of stresses that people have been experiencing as a result of COVID. And this is one of the reasons why people are grinding their teeth at night.
Because I think, along with me, nobody would have ever thought you could go and get Botox to go along and cure this or, help with it.
Yeah, so Botox is a drug that actually works in between the nerve and the muscle. So what it does is it reduces communication between the nerve and the muscle. So it's very common as the cosmetic drug where people get it done for their foreheads or their frown so that they don't express themselves as much, and hence it helps the wrinkles. But if you then look at it from a broader perspective as to where can people benefit when you stop the nerve from speaking to the muscles, this is a perfect example. I mean, other medical reasons why Botox is used is in cerebral palsy when people have muscle contractions. And what basically happens is you inject it into the muscle that is contracting, and hence it helps people relax the muscle, and hence there's less pain. It's typically also used in bladder as well by urologists where people have bladder spasm. So there's lots of uses of Botox outside cosmetic, but when it comes to grinding their teeth, it sort of sits on the overlap where people who were typically getting it for cosmetic reasons have discovered that it has helped them for grinding their teeth, basically. And it is one of the most common uses of Botox.
I mean, some of the things you're mentioning today that getting Botox can help with, I've got to say, I would not be alone in that to go along and say, well, hey, I've never heard of some of these. Would your dentist recommend it? Would your doctor recommend it?
Yes. So basically, Cosmetique, we've got 13 clinics around the country, and we've got one in North Adelaide. We typically do it for bruxism. Now, GPs are a good place to start, and they would be able to recommend you to a dentist who would be able to provide this treatment as well. But for dentists to provide Botox for bruxism, there is additional training that's needed. If patients are in states such as New South Wales where we can't help them, the best people to call would be the Australian College of Cosmetic Surgery and Medicine. They essentially train medical practitioners in all things to do with cosmetic medicine and surgery, and they'd be able to refer them to a appropriately trained practitioner. At the end of the day, the most important thing in healthcare is that patients see a practitioner who is well trained so that all medical treatments can be done in a safe manner.
It's just, I did not have any idea as well, about all this, which is why you're coming on the show as well. Give a plug for the business, Cosmetique. Tell me all about it.
Yes. So basically, we started off as a West Australian business, and we opened in Perth, and then we've now expanded up to Brisbane, to Melbourne, and in Adelaide as well. We mainly provide cosmetic injectable treatments and laser hair removal. And in Adelaide, we are in North Adelaide. And our phone number is 1300-320-272. So I had to look that up. I hardly ever call myself.
Exactly right. That always happens all the time. And your website is? AustralianCosmetic.com. And our Instagram handle is Cosmetique Surgery. And most of the patients usually find us using our website or our Instagram. It's how we find things nowadays. Dr. Vivek Eranki, thank you very much for talking in today on 5AA.
Thank you so much, Richard.
Thank you.
Cheers. Bye.
I didn't have